So in the exam, so this dosage formulations, each dosage formulations you will get 10 marks. So we have, I think, what is the practicals, you know, how much weightage you are, anybody knows? So out of 100 marks, how much, anything idea? 100 marks, you have 100 marks. This dosage formulations, 10 marks. ADR reporting, just now I have shown, ADR reporting, that is 10 marks. Then CAL, what is CAL? What is CAL? CAL lab, you have seen CAL lab or not? Not even come to pharmacology department. We'll force you come to the CAL lab. Computer assisted laboratory. So previous days, those days we are very lucky, at least we are doing rabbit, we are holding the rabbit. We are holding the rabbit and we are doing mydriatic meiotic experiments. Nowadays, this government has been very strict and they are not allowing animals to do any experiments. They have given, instead of animals, they have given computer. So in computer only you should put the drug, you should see the mydriatic effect, you should see the meiotic effect. Those days very, very lucky because we are giving some anti-mydriatic drug means what a beautifully dilatation of pupil. What is mydriatic, man? I told you just now only. Mydriatic, dilatation of the pupil. What is meiotic then? Just tell me the opposite at least. Constriction of the pupil. Is it not? So that time, 2004, second year I am, like you, 2004, now 24. 20 years back, we are nicely holding the rabbits. Every 5-6 members, they are giving one rabbit. So they cannot give one rabbit to one person, no. So at least they used to give some 5 to 10 members one rabbit. So we used to give, time is, in the exam time, they will give half an hour. So we used to give the good topic. They will ask only, what is local anesthetic? How do you perform local anesthetic? How do you perform mydriatics? How do you perform meiotics? So this is the question they used to ask. But now, for you, nothing, how to sit in the AC class? Simply listen to the PPT which I am showing. Very boring now, very boring, really. And at least we have chemical analysis of urine. How drug excretion will take place. We are doing some biochemistry experiments like you are doing for salicylates, alkaloids. We are doing some experiments. If some purple color comes, if yellowish color comes, means that we are doing. That also they removed from pharmacology. Everything they removed. Only one thing you can enjoy is CAL lab. Only one thing is you can go to the CAL lab. We will give some 5 members. How many? Your batch is there. So we have 35 systems are there. So each system you can occupy 4 or 5 members, and you can see your mydriatic effect. Hold the mouse, put the drug there only, see the pupil will dilate. That is CAL lab, over. Pharmacology over. Spotters 10 marks, Spotters 10 marks. Prescription writing 10 marks. Prescription audit 10 marks. Dose calculation 10 marks. 40 ho gaye. So dosage formulations 10 marks. Then mannequins, either mannequins or devices 10 marks. Either we can give. So that is 40 plus 20, 60 ho gaye. This time, this CAL lab will give ADR reporting and CAL. You can go for mydriatic, meiotic or local anesthetic. So 80 marks over. Remaining 20, Viva. Remaining 20, Viva. So one of the dosage formulation is now topical. So in the exam, we may give either topical or liquid or solid or parenteral. But every one will get one of these 4. Somebody will get topical, somebody will get solid dosage formulation, somebody will get liquid dosage formulation, somebody will get parenteral. So nothing to worry. So this is included in the competency 2.1 mark. We will give the question, demonstrate and understanding the use of various dosage formulations. So we will give oral, local or parenteral, solid, liquid. Now local otherwise called as simply topical. So topically, this is one of the exercise we are giving. So I think this is over now. Oral dosage formulation, solid, liquid over. And so oral means we can go for solid or liquid. Parenteral covered, I think. And the only thing remaining is topical, local or topical. So this solid dosage formulations, what is the better means? So the topical why you are giving means the only advantage is they are potential in enhancing their local action. They will preventing systemic absorption. The only advantage of this topical advantage, you are preventing the systemic absorption. Only topical means topical action. You are not giving systemic. So that is the only advantage of giving this topical formulations. And it is available in the form of, you know, that I bought some lotions, creams, ointment. So can you distribute among yourselves? Please come this. You please come, ma. Anybody please come this side. Don't take to your homes or hostels. I am counting this number. I will count now again. Huh? Ointment is there. If anybody take ointment, gone. There, ointment, it is also there. Dummy. This is also expiry date over. Okay. So I am giving 12. So all the topical formulations, they are available in the form of lotion, cream, ointments, powder, drops are there. So what is the advantage, ma? So this is an alternate to oral route, parenteral routes, few GI side effects. Correct or not? If you are administering topical, we'll ask you what are the advantages of topical administration. So few GI side effects, abuse also very less. Correct or not? You copy this one, ma, because it is not there in your records. What are the advantages of topical routes? GI side effects, abuse is less and easy to administer. This is advantage. You please take it, ma. It is not there in your record. We'll ask this question. While giving this topical route, what are the advantages of topical route? What are the disadvantages of topical route? Only disadvantages is local irritation. Suppose if you are applying an ointment, lotion, sometimes it may cause irritation. It may cause contact dermatitis. These are the very good advantages and disadvantages of topical routes. And they are all lipid soluble, poorly lipid soluble drugs. So not absorbed via skin or mucous membrane because of high molecular weight most of the time. So types are there, ma. Solids we have dusting powders. So semi-solid are there like cream, paste, eye drops, enema, suppositories, ointment, lotion, jellies. But I will not keep in the exam all. We will not keep, ma. We will not keep. I think they have shown this. They have shown this one for you, for solid, liquid, topical. Did they show or not? Not shown, huh? Come, ma. So you also distribute this. Distribute your friends. How many are there? I'll ask you only. 7. I'll ask you 7. You please give me 7 while going. So distribute yourselves. So that laminated sheet will give the questions and you supposed to answer the 4 or 5 questions. So simply, I will show you the PPT only now. So for example, we have given one dusting powder. Anybody got that question about dusting powder? So we'll give that dusting powder as a question. One question will come to you and you supposed to write all the 4 or 5 questions. There only questions are there. You should write the answers for that and we will ask the questions related to that topic only. Say for example, I have asked just now, what are the advantages and disadvantages of topical route? We will come you, if you write, we will give 10 minutes time for that one. Suppose dusting powder, one person came, you only got dusting powder. So that 4 questions are there. In the exam, you should write all the 4 questions with answers. We will come to your place and ask the questions related to the topical. So I have asked what are the advantages and what are the disadvantages of topical route. So this is a mixture of fine powder for external use. So it is applied with powder puff or soft brush to prevent friction or bed sores. We will commonly give for bed sores. How many of you seen bed sores, ma? How many of you seen bed sores? Have you seen any diabetic patients with bed sores? Have you seen, not seen? Go for wards. If the patient is suffering from diabetic ulcers, definitely you will see that the bed sores also. Unbearable. If you see the buttocks, entire buttocks filled with bed sores. So that's why they will keep on changing the position frequently. For 1 hour they will change from semilateral, supine sometimes. So for every 2 hours they will keep on changing the positions to prevent the bed sores. So best examples are this boric acid, neosporin powder, betadine powder. Anybody got this powder? Neosporin powder. I think it is there. That's show everyone. Stand up. No problem. Just show that one. So that is neosporin powder. So neosporin powder. So this is the question, which you got. Have you got this question, Hey, who got that question? Stand up. Dusting powder. Just read that. Say, what is the first question? Okay, you can read that question. Same questions are there or not? Identify the given dosage form. What is the answer? So the given dosage form is a dusting powder and it is given topical. So the 4 questions answer will be, so the given dosage form is dusting powder and it is given topical route. Answer should be like that only. You need not worry. I will send this all in the PDF forms. Solid, liquid, topical, parenteral. I will send you in PDF form. I will tell you to Vishnu to send. He will send everything. Second question, Yeah, where is the dosage form administered? So this is meant to applied on the intact skin and wounds on the skin. Third question, other drug formulations is such formulations. So what other formulations are available? So not only this one. So neomycin powder, Maxell powder, boric acid powder, and last question is, what are the advantages and disadvantages of giving this powder, dusting powder? So systemic side effects will be avoided. Why systemic side effects will be avoided? You are not giving parenterally, you are giving topical. That's why systemic side effects are very less. One I have told, GI side effects are also very less. Disadvantages, it requires repeated application. Correct or not? What is what is clotrimazole powder? Now you are frequently applying, and nowadays it's very common. Now you are getting sunstroke, not sunstroke. It's an antifungal drug. For this, it acts as for sweat, to decrease the sweat. We are using antifungal dusting powder, clotrimazole, not cotrimoxazole. Remember, it's an antibiotic. It is a clotrimazole. It's a antifungal drug. So patch we are not giving, transdermal patch also it is giving topical route, but in the exam we are not giving. But in the record it is there. I have given in the record, just go through it. So whatever in the exam we are giving, I am discussing now. So transdermal patch I am not giving in the exam. We are not keeping in the exam. But you, what are the best example for transdermal patch, Hyoscine, nitroglycerin patch, nicotine patch also there. Hyoscine where you will give, Where will you give? Motion sickness. For motion sickness we will give hyoscine patch. Nitroglycerin, so MI, and diclofenac patch also there. Nicotine, to decrease the cravings of smoking. To decrease the cravings of smoking, we will give nicotine patch also there. But we are not giving this one. We are not giving. So this is the best advantage is controlled release of medication of the patient. For example, you see this one, 0.4 mg per hour. 0.4 mg per hour means every hour it will release the drug only 0.4 milligrams. 0.4 only it will release. So the best advantage of this patch is it will release controlled release of the drug. So this question also it is there in your record, but in the exam we are not going to keep. If at all if our mindset changes, if I keep patch also, but just go through the record. So what are the advantages are there? What are the disadvantages are there of transdermal patch? You should go through the record. But most of the times we will not keep. So topical we are almost 6-7 are there. We will go through 6-7 only. We will not keep this one. Cream. Anybody got cream? Any cream, Nobody? Where is? Hey, somebody got stand up. Who is that black sheep? Who got cream? There is nothing to shy. Just read, read. So cream, remember, okay, nothing, no issues. So creams are semi-solid preparations, non-greasy. Remember, we'll ask in the question, what is the difference between cream and ointment? What is the difference between cream and ointment? So cream is a non-greasy, watery base. Non-greasy, watery base, oil in water preparation. Oil in water preparations. So example, we have applied a skin and mucous membrane. Common is meconazole 2% tinea infections. I told you just now. All your tinea infections, we will apply this clotrimazole dusting powder. Ads also will come now. Have you seen? Dusting powder ad. Meconazole. So this is the drug that is given 2% for all your tinea infections. So types are there. Aqueous cream, oily cream is there. Example of fluconazole and soframycin. So anybody got the question cream? Where is that laminate sheet got cream? Where is that read, you only read. Is the same thing are there? Identify the given dosage form is there? Yeah, so the given dosage form is cream. That is hyphen, you can put topical. You can put topical. So where is the dosage form administered is applied to the skin and mucous membrane. Read Yes, what other drugs are available in such formulation? You read the answer. Hydrocortisone, clotrimazole,